It may still feel like summer, but another season is around the corner. I mean, flu season. And in a year where we're already dealing with a health crisis, this could be a big challenge. That's why doctors are warning it's more important than ever to get the flu shot this year. So they say we can avoid a twindemic. For more on this, our Chase team has reached Dr. Sumon Chakrabarti. He's an infectious disease specialist at Trillium Health Partners in Mississauga. Always great to have you on the program. Twindemic, this is a new word. What does it mean, doctor?
Yeah, I actually like this one. If you coined that, that's awesome. And I think basically what it talks about is influenza and COVID-19. They kind of happen under the same conditions, and they could happen at the same time this year in the fall and the winter months.
Now, how much of a toll does influenza take? COVID out of the picture. Influenza, how much of a toll does it usually take on the healthcare system?
This is big. And, I've worked in this for the past 10 to 15 years, and we see every time in the fall and the winter months, our wards, our ICUs, they're filled with people who require help for influenza. This is not just a simple cold for many people, especially older individuals and those people who have health conditions. So it is a big thing. We get an explosion of cases, usually in the mid to late winter.
And now put COVID-19 in the mix. What picture are you seeing?
This could be trouble. Now, that said, I think that we are much more prepared for COVID than we were back in March. But, if you have a whole bunch of cases all happening at the same time, there is the chance that you could have, the overwhelming of certain hospitals or certain healthcare systems. So I think it's important for us to do whatever we can to prevent this from happening.
But, when COVID-19 first came about, and I'm talking about back March, April, think back then with me, and there were concerns the healthcare system would be overwhelmed, that people would be being treated out in parking lots, etc. It didn't happen.
Yeah, that's an awesome point. And part of this is because it wasn't a perfect response, but as Canadians, we did a great job overall as a team to kind of get through this. There were places that got a bit close. It was a little bit close in Quebec for a little bit, but overall, no hospital in the entire country was overwhelmed. And now we're much more prepared. So I do think that overall that there's going to be a much less chance of this happening, but we still need to be prepared.
The symptoms of influenza and COVID-19, because they are so similar, doctor, what sort of problems does that contain in and of itself?
This is tough, and this is going to be one of the things that we have to grapple with as docs, and also even in the schools, because the symptoms can be exactly the same, and you can't really tell them apart without a test. That has implications for staying home from school, has implications for how we treat people in the hospital. Mm-hmm. It's going to be tough, but I think that we have testing in order to discern that.
There are people who say, no flu shot, no matter what, I'm not getting it. Whether they don't like shots, whether they don't think they'll get sick. What's your message to those people?
My message is that, the shot might not help you, but what it can do is if it makes you sick for a couple of less days, you're actually much less likely to spread it to others who can get sick. And especially with COVID-19 on the horizon as well, anything we can do to reduce hospitalizations of people is going to be helpful. So reconsider, at least for this year. We can talk again next year.
Yeah, and this year is what we're concerned about, because when does actual flu season begin, and when will a vaccine be available? Because I think it's already available in parts of the U.S., right?
That's right. And usually around this time, I would say about October, we start to see it. I always get of course, the first or second day, but you want to get this as quickly as possible. And I really urge Canadians to reconsider if you're hesitant, because it will be helpful with you and everybody else.
I think I used the word vaccine there, but I meant flu shot. But I was thinking vaccine for COVID. While I'm thinking that, any word?
Well, we're getting closer, but I think that, Canada has gotten some doses guaranteed. I'm thinking that it's going to be going needles into arms in March and April. Okay,
final question for you. With all of the protocols in place and people worried about COVID-19, worried about getting COVID-19, then they're worried about getting influenza. Will it be more difficult to get a flu shot, and should we overcome that concern of going in somewhere to get the shot?
Yeah, I think that's a really good point. But I think that the shot's going to be put out just like it normally is, but there'll be precautions. They'll be spaced out. People will be wearing masks. I think it'll be quite safe. And overall, I think that the risk is much outweighed by the benefit of getting it. So again, if you haven't considered, or if you don't know yet, please get the flu shot. It's going to help everybody this season.
I want to thank you for your time, Doctor. Great to have you on. Dr. Sumon Chakrabarti is an infectious disease specialist. He is at Trillium Health Partners, and we reached him in Mississauga.